Have you ever had a problem that was so big you can't describe your life without this problem? Narrative therapy calls this a problem-saturated story, and it might have the tools to help turn the problem-saturated life into your preferred way of living. Narrative therapy was co-created by Michael White and David Epstein in the late 1970s. Michael White was a well-established family therapist who met David at a conference, and an enduring friendship began. Their collaboration and commitment to help both individuals and families was the beginning of what is now known as narrative therapy. Together, they created the Dulwich Centre in South Australia, where they help numerous clients and train new narrative therapists. Narrative therapy is a part of the social construction and social psychology arm of therapy approaches. This also includes DeShaz's solution-focused therapy and O'Halloran's possibility thinking. Payne describes that the main approach to practice is identifying through understanding patterns of language, how people construct their social world, and helping them to reconstruct the world by using language differently to identify possibilities for change. Tan expands on this description by stating what people tell or believe about themselves is what greatly influences their sense of reality. He explains that narrative therapy aims to reduce the power of stories that are negative, oppressive, and problem-centered by empowering people to reauthor their lives with other stories that are more constructive, so that they can explore and try new options and possibilities in their lives. Narrative therapy is classified as a family and community therapy, yet it is used with individuals and is effectual for a wide array of issues. It has been proven effective in the areas such as addictions, eating disorders, stealing problems, self-harm, body image, family conflicts, young people with autism, depression, anxiety, and phobias. In general, it is a therapy that can be integrated with other theories to tailor to the needs of each client. Although because of its underlying social construction assumptions, it might not liaise with therapies that have a different understanding of the nature of problems. For instance, choice therapy sees the core of a problem as part of an unmet human need, and the person is held responsible for their problem and finding alternate positive behaviors for meeting those needs. Choice therapy aims to help a client understand that their anxiety, for example, is actually the client anxietying in order to meet an internal human need. However, narrative will see the problem anxiety as an external force that is influencing a person, and it does not need to have attachments to the human internal world. So care must be taken in considering which counselling theories to integrate with narrative. One of the limitations to narrative therapy is the way in which it asks lots of questions and believes the client to be experts in their own lives. If a client lacks confidence, intellectual capacity, or struggles to articulate, narrative therapy can lose its effectiveness. It can be used cross-culturally, however, care must be taken to understand cultural appropriateness of some of its methods. Direct questions and the exploration of variations on views about family and the world might be inappropriate for some cultures. I will now present 3 key features used in narrative therapy. Number 1, externalizing. Narrative therapy stresses that the person is not the problem is the problem. Narrative does this by externalizing the problem from the person's identity. One way it achieves this is by naming the problem. Then it can be discussed as an external aspect to a person's life. A client is prompted to name their problem, and then questions would be asked to evaluate the problem's influence on their life. For example, if a client names their depression the darkness, then questions such as how much of your day does the darkness come to visit? Does the darkness show up at work? What does it tell you to do or say? What does the darkness try to make you feel or think about your life? When do you notice it most? When is the darkness not present in your life? When externalizing questions are done empathetically, it is empowering for the clients. It takes the burden away because it no longer is part of the person's identity and they do not have to label themselves with this problem. Morgan expands this concept of externalizing with this example. If a client says, "I'm unmotivated, I can't do anything," the counsellor would turn this around and reply, "So the problem has affected your energy levels." Or the client announces, "I am a depressive sort of person." The counsellor replies, "So the depression has made it hard for you to go out." This idea of externalizing problems can have limitations in that it could minimize problems or even cause a client to not talk about it, which could be dangerous when working with abuse, for example. Counsellors need to get the full context of the problem and keep exploring the issue until the client can securely collaborate with the therapist to find the problem that needs to be externalized and then develop a name that suits the client's experience. This is such a different approach to many counselling methods, and it's one of the key features that is foundational to narrative therapy. Once externalization is established, the rest of narrative therapy can begin. Key feature 2, looking for unique outcomes. When a client is telling their story, they can fleetingly mention for a moment or an event when the problem was not present in their life, or when they acted in contrast to the problem. This is called a unique outcome. The therapist will make notes of these and explore these stories with the aim to bring it into the forefront of the client's consciousness. They do this using a timeline map. Looking for events and the meanings, the counsellor will note on these maps, either in the landscape of identity or the landscape of action. Questions that are used to look for unique outcomes include: are there times when you don't notice the problem? When does the problem not interfere? Are there times when the problem is not as bad as usual? Could you think of a time when the problem could have stopped you, but it didn't? What happened? Is there a time when you resisted the problem and you did what you wanted to do, not what the problem wanted? Exploring unique outcomes is helping a client's awareness, hoping to bring revelations such as, "Oh, I have had times when I have overcome, or defeated, or stood up, or contradicted, or even been without this problem." This process also helps clients to recognize their skills, strengths, resistance, abilities, and commitments. With these positive attributes, clients can then begin to re-author new stories and move towards their preferred way of living. The last key feature I want to discuss is therapeutic documents, gifts, and ceremonies. When the problem-dominated story has decreased and a rich, re-authored or preferred story is being lived out, then this is cause for a celebration. Ceremonies have been used by different cultures throughout history to celebrate achievement and commitments for the future. Narrative therapy has tapped into this tradition to help clients celebrate their progress and achievement. Its aim is to affirm clients' progress and create another positive story that they can build on. This can be done with either certificates, letters, declarations, a family peace document, lists, or even the therapist notes can be used. Not only does it have to be documents, as Weaver tells how she would write songs, perform, and record them for her clients. She tells that this was a powerful gift and her clients were greatly moved. Weaver also states that therapists can write letters or poems for their clients. Pictures, artworks that can be done by the therapist's clients or the client's family are also powerful gifts that can be likened to a ceremony. White also highlights the use of ceremonies in narrative therapy. These can be a ritual or event that the client does to announce their achievement. He describes a client had a handing over ceremony in a coffee shop where she gave him back a toy that was given to her at the end of her therapy. She felt it was time to return the toy in order to help others. Morgan also tells of a client who invites guests and did a presentation, a certificate ceremony, followed by eating cake made by the mother especially for this ceremony. It's easy to see how ceremonies can affirm achievements. Narrative therapy also suggests there be witnesses to these events to turn these moments into even richer stories. This presentation has highlighted 3 key features to narrative therapy, yet it has so much more to offer. Its foundation in social constructionism makes it a complex but relevant therapy for today's Western society. It has a proven effective practice model for counsellors and has seen numerous clients move beyond their problem-saturated stories to live more positive and enriched lives.